So let's talk about community entry strategy. So the strategies in community entry is what we are going to discuss today, but the main topic is going to be community entry. And in doing community entry, there are steps, and these steps they are 4 steps. And when we talk about these 4 steps, they must be followed, and they are systematic one after the other. So you do first create awareness among sub-county leaders undertaken through existing structures and officials, including the Deputy County Commission, DCC, and others. We have conducting situation analysis. When we talk about conducting situation analysis, particularly assessment of the household registration, are intended to provide basic information for planning the situation analysis. And then we have plan action to improve health status. When we talk about plan action to improve health status, that is self-explanatory. And then the fourth one is established information system to monitor change. This is the fourth step, and we are going to discuss all these steps in this video. So we talk about awareness creation, which is the first step. Awareness creation among sub-county leaders is undertaken through the existing structure and officials, including Deputy County Commission, the Sub-County Development Committee, and relevant and any other relevant line ministries. So we have the facilitation team should ensure adequate knowledge of the district situation as part of this first step. During this workshop, the community strategy introduced focusing on linkage structure, their information, linkage structure, and the information composition and function as is described earlier. So we have, in addition, the workshop would outline a district level community strategy implementation plan and identify officials to spearhead it. This workshop should be followed by workshops and meeting at division and health facility levels, and concerning down to community unity levels, repeating the same existence of awareness creation, yes, of awareness creation. So we are going to the second step, which is situation analysis and household registration. Under this step, the participatory assessment of household registration, and instead of providing basic information for planning the situation analysis. So we have some steps in this step, which is first one is exploration. And when we talk about exploration, this sub-step entails the relatively low key facts finding mission to enable the service providers, particularly the community health extension workers, coming into the community again, an undertaking of life as it is lived in the community. The findings should be written up and shared with community, highlighting the facts that the community people speak about with emotion such as fear, frustration, anger, joy, hope, and anticipation. The second sub-step is protocol. This sub-step entails identifying the gatekeepers, formal and informal leaders, in order to formalize the process and gain authority to work with the community. The facilitators introduce the community strategy idea to the leaders in order to involve them in the rest of the community process. Together, the group clarities the objectives and identify all target groups to ensure that they are included. Participatory assessment, this is the sub-step for step 2, and this process starts with discussion with the key individuals at every level and control point down to the household. This ensures that the introduction of community strategy takes full cognizance of what is going on in the community. The idea has to be negotiated through the gatekeepers at every level down to the level of individuals concerned. In this process, the community is asked to define the issues to be included in the assessment and thus set objective for it. Under each objective, the assessment and planning task group defines indicators, key questions, that is, it identifies the source of reliable information and it determines the most appropriate method of gathering the information. They then develop information gathering tools like checklists, interviews, guides. The scope of the assessment should include the population size and structure, community structures, any existing community information system, resources available, that is access and management like money, manpower and material, service delivery and the package of care and support, communication strategy, networking, collaboration and linkage, copying machines innovations and best practices. And then we have, how do we call it? The status of health and well-being based on agreed indicators. The status of food security and nutrition based on agreed indicators. Care-seeking behavior. The environment, this is when we talk about water, sanitation, shelter, soil, vegetation, and infrastructure. We identify dialogue centers and groups. This we have like religious institutions, schools, civic leaders, youth groups, and other sectors, their roles and responsibility. The assessment method may include transect walks, direct observation, mapping of the availability and access to resource, and a seasonal calendar of event activities, disease, food availability, and many other more, and daily activities by gender. Other tools might be Venn diagram to understand stakeholders, key information interviews of individuals from the community to focused group discussion. During this process, the task group may also carry out household registration and mapping to create village register to be kept by frontline health providers, and this may be community health extension workers. Specific activities may include in this step. We have activity 1, review the history of the community over 10 years, events, achievements, and challenges. Activity 2, carry out household registration and mapping, creating the village register. Activity 3, review community resource assets, manpower, and networks. Activity number 4, map the community health situation and the costs, thus summarizing the community profile based on the household register. And when we do this, we talk about the population structure, environment, immunization, place of delivery, use of family planning, disease, birth and deaths by age and sex, education, food, and income. In the participatory process, the community is asked to define the issues to be included in the assessment and thus set objectives for it. Under step 3, which is planning actions for improving health status, once obtained and processed, the findings are used for dialogue in the established structures to prioritize issues and decide on action. The community participants reflect on the future they want and agree on the main action points. The same task group, as well as additional working groups identified according to priority issues, are assigned to prepare plans that are collected and presented to the whole group for consideration and adoption. The process allows all the partners to explore what relevant actions are already in place in order to add double options that are lacking. Planned actions must be based on available resource for action. The activities may include, remember last in the previous second step, which is participatory assessment, we shared about 4 activities. So the 5th activity is facilitate dialogue on community health situation. This is like why, what has been done, what more can be done. And then activity 6, identify action options, select double options, that is. And then activity 7, outline actions by time frame for various groups and individuals. The plans from the different interest groups should be harmonized into one community unit plan. The community health extension worker, the local and governmental organizations, and the CBOs and other extension staff within the community unit provide technical assistance throughout the process of assessment and planning, with the community health extension worker as the responsible technical person. The integrated community unit plans are submitted to the health facility committees where they are discussed and provided and approved by the committees based on resource identification. Finally, the community unit plans are consolidated into one integrated division health plans for level 1 activity and submitted to DHMT, District Health Management Team. Step number 4 is about establishing information system to monitor change. The information system for monitoring change will be set up in the following ways. So in the previous step, we shared about activity 5, activity 6, and activity 7. And this step 4, we're going to share about 3 activities that should be done in this step. So activity 8, analyze the information gathered by the community health workers and supporting task groups. Activity 9, facilitate regular evidence-based dialogue and community days. And then activity 10, which is the last one, disseminate, analyze information for dialogue, advocacy, and social mobilization. And this is all about the community health service strategy steps in community entry. Thank you and be blessed for your time. Remember to subscribe, like, and comment in this channel, and be blessed.